Hi nurses, congratulations! You have been selected to join the ICT Hospital's medical care team. Today is your orientation and we don't plan to bore you today, so guess what? We came up with a short little demonstration to show you what to do regarding privacy, confidentiality,
and most importantly, Madeleine Leininger's culture care theory. We want to remind, probably educate some of you guys on the do's and don'ts of what to do in the hospital.
So get out your notepads and listen keenly and enjoy the video we have presented for you.
yeah. It's now 10 o'clock and Bianca is not at work? This is absurd.
Every day I come here, see everything I'm going to do, face me after I sweep, I'm tired of it. Help, help, help! My daughter in pain! She can't walk or something with her! Hurry!
Where's the doctor? Be gentle with her now. Alright.
Please help me, daughter!
Okay, I am Nurse Mackenzie. What is your name? I understand this is a stressful situation, but just work with me, okay?
Alright, you can be listening already, can
Okay, what is happening to listening today?
Alright, so down here, so you swallow, bleeding, and she complain with
Okay,
pain.
do I have permission to touch her, mommy and daddy?
Yes, full of nurse.
Do I have permission? Okay, I'm just going to palpate the area to see where she's feeling the pain, okay?
Alright.
Okay. Based on my assessment, I will have to get the sister nurse for this, okay?
Very nice, what we do? No nurse. Alright? Jesus Christ, yo, just pray about this. Demons, them have to this baby, yo.
Good morning, parents.
Man, really?
Your names are Mr. and Mrs. Campbell, right?
Yes.
Alright, so based on the situation, I will ask you guys to step out of the room so we can have a
No,
conversation.
with that alone in here.
No, the nurse.
No, I'll be staying with her, so it's okay.
You know, so come back here.
Alright, follow me, thank you. So Mr. and Mrs. Campbell, you can have a seat, please. So Mr. and Mrs. Campbell, based on my conversation with Nurse Mackenzie, she's telling me that your daughter is experiencing a lot of pain in her genital area. Can you tell me what happened, please?
Okay, so this is a part of our tradition called infibulation. We would suppose I will sew up her vagina in order for her to remain pure for marriage.
Okay.
So I did this as a girl also, and it didn't cause me any harm. I didn't know that I was harming her. I just thought we were doing the right thing for her.
Nurse, I don't know what happened. Because it's swelling a bit longer than usual for go down and she bleed excessively. It means she complain with excruciating pain. Nurse, I don't know what to do, nurse.
Okay. Alright. Okay. Alright. So we'll do our best to provide the best quality care for your daughter. This is a very sensitive and rare situation. However, we will provide additional resources to help her get over that, and if anything, because of the sensitivity of it, we'll provide additional resources. And because I know that.
Only that, please, nurse.
Alright.
Baby.
Okay. Alright. So because of the sensitivity of the situation, my team and I are ready to provide any support you guys need, because based on research, we know that this is not something that only affects a person physically, but also psychologically, right? Okay, so we have to admit her, okay? Do you have any questions in that regard?
Can we carry a statue? For the God we worship.
Yes, you can most definitely carry a statue. Alright.
Also, can we come at 5 a.m. to worship? We normally come at 5 We normally do worship at 5 a.m.
Alright, because of the timing, I cannot allow that. However, what we can do is, if she's awake at 5, does she normally get up in the morning?
Yes, great.
Alright, so my team and I will be make sure that she's up, and we'll facilitate you guys through a phone call. Is that okay?
I think there's.
Okay, that's fine. That's
All right, and then you can come at your regular visiting hours. We'll work around that to plan our pain management. Okay?
okay.
All right.
Please, nurse.
We will help your daughter.
Thank you very much, nurse.
All right. So I'm going to leave you guys at this time in the waiting area. I'm going to gather more information and come back to tell you exactly what we need you to take and if you have any other questions for me. Okay?
Alright, thank you, nurse.
You're welcome, guys. No. You see my darn trial? Imagine so much patients there to take care of. So much things to do. And Nurse Bianca is late. It's almost 11 a.m. And she's not here. Listen, try and get it together, As you see, if she don't get it together, I'm going to get it together for her.
Mr. Philip, I feel like we are once night. Mr. Girl, last night the party turned over. Work. About 10:54 now. We don't even know what time I reach, but anytime I reach, because sister them not have nobody. So work time when we reach. Anyways, we tell them to come up with me. So I'm like, oh, you know, later.
I said, my day I do my care plan. I want my excitement. Why you always come late and I miss the excitement?
Party did too hard.
You know, it's more just status. But let me tell you, Kada, one year right here, so she know the mix up.
Come in at this.
What up, mom?
This morning, I said the woman called me, she skin working on first of all, she skin right out, I said, I never smell nothing. She called me and said she's so bad, them so bad for me. And the parents in my bed like, I'm not doing she had some birth defect or something.
No, them call it genital mutilation. But it's something illegal. They're not supposed to be doing that.
That not illegal?
It's illegal. I remember reading that case, and the parents, what had happened, somehow it did get out, and then they have a call police, and the police intervened, and the parents had to lose the child because that's not illegal. That's illegal
Here.
here.
Like, I'm not, let me have to call the police on them, yeah?
Call.
This can't work. Hello?
Hello,
Yes, officer. Good day.
good day.
A situation is happening at the hospital, A patient, she came in with her front stitch up.
Excuse me?
Right up to the brim, sir.
I don't
One
get what
little
you're saying.
girl too.
Her front is stitched
Yes, stitch up. Our parents know with nothing to her, like it normal.
up. She's like hospital right now?
Yes, sir, she is.
Okay, I'll be on my way.
What is happening here? No, what is really happening here? Cause it can't be the nurse. We're late. Mix up to my office right now, please. To my office.
Of course, we are making a meeting.
I would say good morning, but the morning has not been good so far. Where to start? Miss Deb, you have been here for how long? 15, 20 years? And you're still carrying on with all of this foolishness? What do you have to say for yourself? Well, I have something to say to you. You are fired.
Okay.
We no longer work here.
Okay then. Okay. We don't need this. We don't need this. Take room there.
Now that we have gotten the small part out of the way, it's time for me to handle the both of you. Because what is your explanation for that? You see, Nurse Jada and I running up and down, and not one time you stop and say, let me assist. But no, as the foolishness starts, who is that? Nurse Shanna. This is not new, I'm not even surprised. And Bianca, you with your tardiness, you're not tired to be tardy. You need to change your name. You need to change it. I'm going to call you from now, Nurse Tardy. As a matter of fact, I don't even know if I must keep you on. Right? Because what the patient then do to deserve this? But, let's take it the civil route first. So, I'm going to give both of you the code of conduct. And you're going to turn to the page that talks about culture care theory.
Found it.
You find it, Shiana?
Yeah.
Alright, so I'll start. Because if I ever follow how I feel, I don't handle you guys with it. I not even want to start. Let me just start. It says confidentiality and privacy are fundamental in healthcare. Nurses have an ethical and legal duty to protect patient information, ensuring it's only shared with authorized individual. So I have a question. Is Miss Deb authorized to know the patient's information?
What do you think the janitor authorized?
And that was not the case. We were here talking
Listen,
about.
don't bother justify your foolishness, please. Please, let me continue. Thank you. We cannot tolerate any insensitivity or breaches of confidentiality towards the patient, right? Trust and compassion is the core of nursing care. Were you compassionate a while ago? Did you really and truly care for that patient?
Of course, that's what we tell her, call the police.
Listen, you see, we have to respect people's differences. I know that we are used to a particular culture, but we have to embrace their culture. You can imagine if you go overseas now. Would that be a problem, you know? On so many different levels. Because guess what? You didn't follow the right protocol. Right? So I know that it's different. And technically, you can't say it wrong. But we have to respect their culture. Nursing is not just about curing disease or administrating medication. It is the core. Nursing is about care, and that care is inseparable from respect, dignity, and cultural differences. You guys are following so far?
Yes.
You guys have allowed negligence, bias, and disrespect to enter into our caring facility. Is that right? How would you feel if that was your mother? How would you feel if it was somebody for you? Couldn't go down. Right? So this cannot continue. Right? It's not about just having the skill to say, I am a nurse. If you just have the skill, you're just a technician. Nursing is about caring. And if you don't care for your patient, it don't make any sense. Right? So we're going to talk about Madeleine Leininger's culture care theory. Right? This teaches us that cultural current care is essential to nursing. It's not just about knowing what to do medically. It's about understanding who our patients are as people, their values, beliefs, and their custom. And without understanding, you are not a nurse. You're merely a technician. It shows us that health is not just biological. It's social, cultural, economic, religious, and environmental. Every single patient who walk through our doors bring with them differences, and it no matter where them come from, what them have, we have to take care of them because it's our job. That is what we signed up for. Okay, ladies? All right. So I'm going to ask you to read number 1 under what Leininger state, please. Bianca.
Culture care preservation. We must respect and maintain those cultural practices that benefit our patients. This means allowing religious customs, family rituals, or traditional practices that promote their well-being.
Right. It would never take anything for me to tell the parents to carry the statue. It's not going to affect the care. It's not in nobody way. It's just something to give them reassurance that a part of them or a part of their religion is there with their daughter while she's receiving care. Sharon, can you read number 2 for me?
Cultural care accommodation. We must learn to negotiate and work with patients to adapt their practices in ways that meet their health needs without stripping them of their cultural identity.
Right. So when the parent suggested that 5 o'clock they'll come here, I can't allow that because it's outside of visiting times. And if I do it for one person, I'd have to do it for everybody. And then by when the whole in here pack up. So what I did, I just tell them to have a phone conversation at 5 and we'll facilitate that. It doesn't take anything out of us to just plan her care around a 5 a.m. call? Does it?
No.
All right. And I'll read the final one. Culture care repatterning. Sometimes we need to guide our patients in changing harmful practices, but this must be done respectfully and collaboratively, not with arrogance or authority. When Nurse Jade and I were talking to the patients, you hear we call them down and tell them that they're idiots and what them do a foolishness? Yes, it's harmful, and I'm sure they realize that now. And then when we provide them with additional resources, then they'll have a better understanding. But we still have to allow them to make that decision because it's not up to us. We just have to care for them. Okay? At the end of the day, ladies, we signed up for a job that really helps people. We see them at their lowest time financially, economically, physically, socially. And if it's not something that you're willing to do, it's best for you to look at next job. Okay? So I really and truly don't want to fire you guys because you guys have potential. But don't let this happen again, please. And if you see any other nurse behaving in that manner, I expect both of you to explain to them why is it wrong and talk to them, right? You don't have to shout and go on. Just talk to them, okay?
Understand.
All right, so this is the end of it. I'm going to still speak to the other superiors, but I'll basically tell them that you understand and you were accommodating to what I told them, right? And ask them to give you leniency. Okay, ladies?
Thank you, sis. Thank you.
Have a good day.
A message from the Ministry of Health and Wellness.